everyone. Welcome to the Art of Wellbeing with me, Diane Alexander, and Christina, Dr. Christina.
Hi.
We have so many cool things to talk about, and it's near and dear to my heart because we're going to be talking about the face.
So we'd love to jump in and talk about GLP-1s and how they affect facial volume loss, collagen, and how it really requires a multimodal approach, and how and why you should see a knowledgeable practitioner about this and potentially have a person with surgical knowledge at your disposal, right? Because then if we're losing 20 plus pounds in our 40s, 50s, and those changes to the face.
60s.
60s. You didn't lose 20 plus pounds. But,
No.
but at any rate,
Yeah.
in those
Right.
decades in life where our collagen and elastin production is
Well, we
by
start to lose
itself.
collagen at 30.
Exactly. 25, you stop making
Right.
it, right? There's
Yes.
a certain type.
Yes.
And then what that means for when you first see a practitioner and you're starting that journey, how do you approach it? And when I've been telling my patients, because we've learned with experience, 3 years of prescribing GLP-1s to patients from, inflammatory arthritis that needs like a microdose to a postpartum mother that needs, 60 pounds versus
Menopausal.
someone, yes,
Yes.
my favorite sensitive patients, my perimenopausal and menopausal
postmenopausal.
women, yes, like that have that insulin resistance and cellular changes that show up metabolically on a macro level as attire and facial fullness, and they don't even recognize themselves in photos.
Yes.
And what were you hearing from patients in, COVID when everyone was on a screen? I'm sure
Oh,
that was a big...
I called it the Zoom boom.
The Zoom boom.
Yes, I was even in the New York Times
Fun.
with my article.
Yes.
But so what I saw was people who had never really spent any time on Zoom. I mean, who used Zoom before COVID, right? Very few. And all of a sudden they were coming in and they're like, yeah, Dr. Alexander, you've got to fix my face.
They're like, whose face is that?
But I think, I've seen patients who have lost weight, lost elasticity, lost collagen, lost facial volume, for my 26 years in practice. But now it's so accelerated,
Right.
and it's so common. And now we're learning, because we've been doing it for 3 years, and we're seeing the effects of what GLPs are doing
For sure.
to your appearance. So it's super exciting because we're able to learn and be able to address these issues essentially prophylactically.
Right.
Like this is what we're seeing. How can we prevent these things from happening? And it's a super exciting time because the GLPs are not going to go away.
Oh no! If anything, more
Yes.
pervasive and widespread treatments for fatty liver disease, people with coronary artery disease, like more and more people are going
Addiction,
on these meds. Oh,
depression.
alcohol,
Yeah,
It's
all the
really,
things.
and I think it's exciting and compelling. But then we need to be good stewards of the medication.
Correct.
And when we place a person on it, you set them up and you sort of say, we have interventions for facial
Yes.
volume loss, that it's not just, oh, wait till you look terrible and then, right? Or till you have your Ozempic face or GLP-1 face. And then, because you don't
It
want
ages
accelerated aging. When you lose
Yes.
too much weight, there's a
Yes.
fine balance, right?
Like we look
Patients-
at baby face.
Yes.
They're full, they're
Yes.
plump, they're youthful.
Yes.
And when you get, and you almost look sick.
if you're too thin,
If you're
or
too thin,
if you become
yes.
rapid weight loss. That's something
Correct.
that I caution patients about sometimes. Because
Right.
when people see me, they want the weight gone and they wanted it gone yesterday.
Right.
But I set really realistic expectations about 1 pound a week.
How to do it healthy.
And that's
Right.
healthy. And this medication is a tool in your tool belt, but it is not the fix-all, end-all. You still need to do your resistance
Yes.
training, which affects
Well,
collagen.
you don't want to have muscle loss.
Right.
Like functional strength
Yes.
is the key
Yep.
to longevity and health
100%.
span and all those things.
And resistance training, the muscles in your
Yes.
body affects the way that your face ages too, which
Well,
is
metabolism.
amazing.
Affects your metabolism.
Which is cool because you'll see people who are worker-outers or have, right, that
Yeah.
they have the resistance training piece.
Healthy
and they
glow.
can have healthier glow.
Healthy.
And more hydration also affects the way that the skin looks.
well, energy metabolism, which we're going to get to. Yeah.
Intake of healthy fatty acids.
All those things.
right?
Brain health.
Supplements, NAD, glutathione. Like there's so many things we can do from the inside
Yes.
that affect the way the skin is going to look, regardless of the weight loss or not, and also from the outside.
Well, I think, so many people they have a goal. I want to lose X amount, this is going to get me to my goal. But they don't see the sequelae.
Right.
And that's something I saw with my patients who had gastric bypass surgery or, stomach, gastric stapling. And they would come in and they're like, I lost the weight, but look at all this skin.
They almost are deflated.
And deflated. And they're like, there are people who gain the weight back because they like being fluffier because their skin looks smoother. They don't want the hang. So that was super, that's been interesting for me over the years, and mostly the weight loss was applying to the breast and the tummy. And then now, with such widespread GLP use, we're learning so much more about the effects on the face.
And that catabolism, that breaking down that we are in of the facial fat pads, right? So the face is made up obviously of bone, deep fat layers and pads, and then the subcutaneous fat, that baby fat that you talk about.
Yes.
Obviously the muscles, ligaments, and then the skin.
Yes.
And so all of these things need to be paid attention to, and not just like, take this medicine, lose 40 pounds, see you later. And if you're not being medically followed with a multimodal disciplinary
Well, you can order online now.
Right,
but our approach is so much different because we want it to be not just a number on a scale, but this is really for your health.
Yes.
And beauty and aesthetics. And we're able to approach it from, a whole different way with you doing a cellular level. And then, of course, there's always surgery.
Yes, there's always surgery. And
There's
then
always
everything in
surgery.
between in the best way, right? Our injectors are, I would argue, best.
Best.
Best at that full facial balancing. Like you go and see someone who is knowledgeable in that. And it's not that, I joke, I'm like the Botox of your 20s or 30s, like a little bit up here.
Oh my God, we were so bad at it.
Like, and what about like this part of your face? What about the structural volume support? And now and I'm not an injector, but the science behind things that stimulate collagen.
Oh, yeah.
It's so exciting.
Well, when I started 26 years ago, we did Botox and it was like for wrinkles. And that was just literally, and now, now you think about what is the shape of the face?
Yes.
Because the facial structures are related to muscular activity. Botox and the neuromodulators affect the muscular activity. So if you block this muscle, you have a stronger this muscle.
Right.
So I don't know how long ago, it was probably 10 years ago, I realized, Botox is actually for shaping the face. It's not for wrinkles. Yes, a side effect of it is, I've had Botox for 26 years. I don't have very many wrinkles.
Very nice.
But there's a whole different approach. And I love being in this field because it has changed so dramatically over the course of my career. And it's still changing and we're still learning. And I'd say the biggest leap that I'm seeing is really what we're doing on the inside to promote the outside. And that's the thing that is so exciting for me to how it all comes together.
Oh, absolutely. When I see patients, and I try to set that realistic goal, right? It's on average a pound a week. Sometimes it's half a pound.
Which is fine.
But that gives your skin a chance to catch up.
Yeah.
But there is a point where sometimes while you're losing the weight in the beginning, because in those first 3 months of being on a GLP-1, a lot is changing and you can lose more rapidly in the beginning. But people tend to feel better. They often can look a lot better, but you just need to have the right multimodal care.
You have to have a plan.
Yes. Lasers, microneedling, injections, exosomes, like all these growth factors, a great home routine and regimen. Like there's so much.
There's so much.
I'm not the one person, just like you're not the one person that can do everything.
No.
But you have all the right people in place.
I know who to send you to.
You know who to send us to. But that's the point, right? That we're not just going to let you hang out to dry, like, okay, go on the GLP-1.
You're going to lose 20 pounds, bye.
And who knows how much muscle, but we're very much invested in patients' long-term health, well-being, and beauty inside out, outside.
I mean, I tell people all the time, it's like it took you this long to get to that weight. You shouldn't try to get rid of it in 4 months. And same thing with the face. You got that sun damage over, 20, 30, 40, 50 years. I am not going to reverse it with one treatment.
Right.
So it has to be a plan. It has to be, methodical and deliberate, and you have to kind of be all in with us.
For sure.
Because we're going to guide you.
I love
the
it.
process.
And I love working at a place where I can say, no, I'm not the expert on this, but go down the hall and
Right.
you're going to find the best person
Yes.
for that, for your laser, for your
Yep.
full facial balancing. And, come up to the Northside office and you can see an incredibly talented plastic surgeon with all these years of experience.
Lots of experience
So
anyways.
much experience,
Yeah.
right? And that we're constantly learning. So there's a recent study about
Sculptra.
which I was really excited to hear about in GLP-1s.
And
You've been saying this for a long time.
I've been saying this for a long time. So my approach to aesthetics and what I think we should be doing is really regenerative, because the human body is amazing. The power to regenerate and to heal, and what we need to do as providers is to tap into that. I mean, everything with stem cells, everything we're doing with exosomes. And so instead of I'm going to, make you fat face, I'm going to fill up your tissue, what we want to do is use every modality that we have to regenerate the youthful cells in the face, regenerate the skin. And that's really, what I love about Sculptra is that it's not an overnight fix. So if you have a party in 6 weeks and you come and you're like, well, I want Sculptra, well, that's not the right thing to do. But if you want to be with me over the course of 1 year or 5 years or, however long, and we have a long-term plan, I want your skin to be incredibly healthy. I want you to have great collagen. And that's what we need to look at. We need to how to regenerate from the inside on a cellular level with you. Are your hormones okay? What's your metabolism? What's your NAD, your energy levels? And then what we're doing on the outside, because the lasers we have, the tribrid laser, the CO2 laser, they're all intended to build collagen. So when you're combining, everyone I'm doing Sculptra on, we work on the inside and we work on the outside.
Right. It's so exciting.
And what I've seen in these patients that I've been working with for years, finally when it's time to do their facelift, when they need the structural work, because that's what I do. Your jowls are down to here, your platysma glands, this is sagging. That's a surgery thing.
For sure.
But yesterday my facelift was on one of Amy's patients, and she, looked fabulous. And when I went in there, her tissue was really strong, the somas, which is the tissue that we're lifting in the deep plane lift. It was really strong, and she was a thin woman. And it's my feeling that if she hadn't had the Sculptra in there, I would not have been able to get the pull I got.
The result.
Right. Because if you go in and somebody has thin somas, I can't get that pull. I can't get I can't get your jowls up to here. So having that kind of support with our injectors, with Mary Pop and Jen and Amy and Rochelle and Lena and Lauren, they know what to do on the face.
Absolutely.
They know how to make you facelift ready. And there's that whole thing we were just talking about how people are like, oh no, I don't want fillers, I just want a facelift.
I've heard people say that.
They're saying that.
I've had in the last month, I don't know if that's a trend where people just say,
I think it's a trend.
I'm not going to do anything to my face until I just need a facelift. And I'm like, I don't think that's really wise, and I don't think you're going to get your best result or look your best in the interim, right? Because when people start doing even facials and lasers, and you can't ignore skin quality.
Well, that's the thing about Sculptra. So for many people, I feel they're disappointed in it because it's not volumizing necessarily.
Well, and it's not an instant thing.
It's not an instant thing.
You don't get the Sculptra and then say, oh, I look great.
I look great.
1 day later, 1 week later.
But what
how
I
long
found
until you see results, typically?
Well, what I saw was that my skin looked great. The first time I had Sculptra, I didn't get a lot of volume from it, but all of a sudden, my skin looked amazing. And then, I've had many treatments with it. And people are going to volumize in a different fashion. But everybody I've seen who we've done Sculptra on, their skin has this incredible health and glow.
Oh, I love that.
And that's, it's not always captured in photos.
But it's when you see a person. And
Yes,
you're
when
like,
you see
wow,
a
what are
person, I'm
they
like,
doing?
no, I didn't give you a lot of volume, but look at how you're
Look at your
glowing.
skin.
Because those are those fibroblasts building collagen.
It's incredible.
And that's really what I love. But I think the thing is that, fillers were like super popular, and then, there was a push to do so much fillers, and then
Right.
people looked weird. And then all of a sudden, when you see bad results, you're like, oh, I don't want any fillers.
Right.
But if you see really good fillers,
You don't even know they had
them.
Yes, exactly.
Like, people
You
are
don't
always
even know.
shocked. They look at me. I'm like, you have no idea how much shit I have in my face.
You're allowed to.
I am.
So tell me what you're seeing in patients who have had filler and have had Sculptra, other than this recent case where you said her skin quality was amazing.
Yeah.
Tell me what that looks like surgically.
The first time I saw fillers in the face on a facelift, I didn't know what it was.
Oh, wow.
Because I've been doing facelifts for so long. And for me, anatomy is anatomy, right? And so I love anatomy. I love dissecting. But there are times where you see filler in the wrong place.
Okay.
You see, like, you're going in a plane and you're like, oh, what's that gooey stuff? Oh, it's an HA. And that's really one of the things I think is so important, is knowing your anatomy.
Yes.
And going to a very skilled injector. So all of our injectors, go to
Countless
dissection,
amounts of training,
go to
right.
dissection courses,
Constantly learning.
Many of them, most of them have come into the operating room with me, and I'm showing them where the planes are. So there have been very few that I've had to change my surgical plan because of fillers and injections, but there have been a couple where I couldn't get into the right plane underneath the SMAS, and then you just change your plan.
Right.
And that's okay.
Okay.
But I think as a surgeon, you always have to be willing to change your plan
flexible.
based on what you're finding. It's only a handful out of, how many
Thousands.
Yeah, how many facelifts I've done.
Right.
But I'm not, it's more of a curiosity thing to me. It's like, oh, what am I going to find? And I get in there and I'm like, oh, there's
Here we
some
go.
HA, there's Sculptra, there's Radius, there's this and that. And I know how to work with it now.
That's great.
And so I think that's important too. I think, again, you see people, these Insta famous people, and they're like, oh, you shouldn't have Sculptra, you shouldn't have Radius, you shouldn't do all these things. And N equals 1. And if you're
a candidate,
right,
and you see a skilled injector that has the
right.
anatomical knowledge about full facial
Right.
balancing,
Exactly.
if you're taking care of your skin health,
All
and
the
yes,
things.
and you've had like weight shifts and weight changes, and any woman who's had a child,
Yes.
we know what it's like to gain 30 plus pounds,
Yes.
and then lose 30 plus pounds, hopefully.
Yes.
But that it changes your face.
It changes your face,
So
absolutely.
there is definitely that thought of how can we prepare our patients best as
Yes.
we go on GLP-1s.
Yes.
And as we just have sun damage and facial aging and gravity
Hormones,
and hormonal changes
yeah,
and all the things
all the things
where
But,
we can help.
If you're experienced with facelifts, you're going to know how to deal with fillers.
course.
I'm sorry, like people get out there and say no one should ever have fillers. That just doesn't make any sense.
And I think it's not, like you say, N equals 1.
Right.
These blanket statements.
Yeah, they don't make any
They've got to
sense.
go.
Yeah, they got to go.
Let's talk about
fillers are bad.
each person, precision medicine, precision
Right.
injectables, facial balancing, facial
Yes.
care. Not every laser is for every person. Not every skin cream or exosome is for every person. It's all unique
Yes.
and uniquely you, and that's what's
N
cool about
equals 1.
Artisan.
Yeah.
Is that we treat patients that way.
Exactly.
It's not a mill. It's not
Right.
everyone gets this. No, each person is really
I
treated
do
as
think
an
it's
individual.
super interesting when I have somebody in, say their 60s and they come in and I'm like, okay, so what have you done? And they're like, I've never had Botox. I'm like, whoa.
Right. Where have you been?
Where have you been? Do you live on Earth?
Yeah, exactly.
How could you never have had a peel, a laser, Botox, and you're starting with a facelift?
Well, and is it, okay, so here's a good question. Is it ever too late for someone to start with Botox or Sculptra, or if they're going to get a facelift with you, what do you tell them in the way of a plan?
I mean, there are certain people who come in And we're going to start with a facelift, you know. But I would say, you know, the majority of people that I see are people that I've been treating for a decade, sometimes 2 decades, and they've already been in my world. And, you know, at a certain point, you look at yourself and you're like, okay, I've done I mean, there are certain people I'm going to look at, I'm going like, no, filler Sculptra, no, we gotta fix the structure of your face.
Right.
It's surgery. But that doesn't mean surgery is all.
Right.
Because I'm also going to want to have you to have the best, most beautiful, most healthy, radiant glow. And that can be any combination of things. And also surgery doesn't always fix everything.
For sure.
Right? So, you know, sometimes you need a little medial fat. Sometimes you need a little sculpting the pre-gel sulcus. Sometimes, you know, you need a little temple filling. You always need Botox. So it's really, again, creating a plan that's right for that patient at that time in their life.
Yes, and just meeting them where they are.
Yes.
In their journey, whether
Yes.
they're completely
Right.
new to lasers and injectables.
Right. I had a patient who came in, lots of patients who come in, and they don't want surgery for, you know, 3 to 6 months. And that's really exciting to me, because then I really have an opportunity to optimize everything.
Yes.
You know, there are people who come in and they're like, no, I, you know, want to, you know, do it now and do this and this and this. But I'd say the majority of people come to me for facelifts. They're
a plan,
planners.
for
They're,
sure.
you know, often professionals. They have to, you know, plan this, plan that, and that. And so I'm never in a rush to do surgery. And there are people who I'm just like, no, you can't have surgery yet. We got to work on your skin.
Right.
And that's a combination of, you know, working with you, comprehensive labs, exosomes, lasers,
Gut health.
skincare, gut health, you know, what's happening with your diet.
For sure.
All of those things are super important.
And so what did you do?
So many of you already know that I had my eyes done, my lower face done, and my neck lift done about 4 weeks ago. It's so hard to believe.
It is
crazy.
Just 4 weeks though, because your healing has been exceptional.
Thank you. You helped a lot.
I'm like, not to toot my own horn now.
No, I'm tooting your horn.
But
100%.
you did the work. That's the thing.
Yes.
I will leave recommendations, and I was just talking to Brett about this. I was
my God.
patients that are motivated and want to do the
We
things,
love working with that.
it makes me so excited. They're a joy to care for.
It's a joy.
Because you tell them what to do,
And
they
they
do
do
it, and then it all works out, right?
Yes,
And then they
it
look
works
amazing.
out.
So you also are a joy to work with. Tell
Yes.
me.
Well,
Or tell
you know,
us what you did.
When you know we're having this conversation about weight loss and GLPs and the structural changes in your face. I mean, as you know, I'm not like a makeup person. I don't spend a lot of time thinking about me and my face and my makeup and my, you know, whatever. I don't spend a lot of time looking in the mirror. And my focus has always been on my academic achievements, my professional achievements. So, you know, I don't think my looks would have gotten me anywhere.
I don't think that's true. I know some of your co-residents that think you're pretty cute.
I'm stuck with my brain for my, you know, whatever.
Beauty and brains, but enough.
Whatever.
Keep going.
I don't really think, but I think I wasn't on a GLP, but my gut was really messed up for about 2 years, and I think that was induced by taking too many antibiotics, which is my own fault. And you helped me a lot heal my gut, but as a consequence of my gut being messed up, I really couldn't eat, and I wasn't interested in food. Nothing tasted good, and you know, I wasn't trying to lose weight, but I did lose weight, and all of a sudden, I had so many people saying to me, "What's wrong? Are you okay?" Like even my brother was like, "What? What's going on?" I had close friends who I hadn't seen in a while.
I had your friends coming to me.
Yes, you
just
did.
So you know.
Yeah, I'm sure, and I know which ones they are.
Okay, and we are working on it.
You know, and I'd be like, yes, I am eating, but I still lost weight because my gut wasn't healthy. So I really think that precipitated. I feel like I just looked horrible. I hated photos.
It changed your face. It
changed
did
my
change
face.
your face from before versus after.
And that's what made me start thinking about what we're doing with our GLP patients. You know, you don't have to get to the point that I got to. And I was like, oh my God, this is a disaster. I need to have surgery next week. I can't be seen in public anymore. No photos. No. So I did some things to prepare for my facelift, as you know.
Some.
You worked with me over months, and a lot of it was psychological. When everybody wants plastic surgery, but when is the timing right in your life? And I spend a lot of time talking to my patients about that. What vacation are you going? What reunions do you have? Are you giving a lecture? Whatever it is, about how the timing's going to work. And so I did a lot of things to prepare my skin. I did a couple rounds of Sculptra, which we've talked about, and I did the tribrid laser. And then I was able to get on Dr. DeJoseph's schedule in a time that worked with my surgical schedule.
You did peptides.
I did peptides. I did exosomes.
Gut healing protocol way before. Right? We kind of cleared.
Well, right. We did all the comprehensive blood testing, the gut testing. I changed my diet.
Hormones were on board. You kind of had.
You optimized my hormones. I forgot all the things I did.
All the things.
And I felt really good. I felt healthy, but I still was sag. I still had this.
Right.
I still had this. See, they're gone.
They're gone.
They're gone.
So good. Snatched.
Snatched. And I've always had saggy eyes. So I knew at some point I was going to have to have my eyes done, but I never wanted to take the time to recover because I've been running for 15 years, and it never occurred to me that you would take time off of running to have plastic surgery.
Right.
So anyway, I got on Dr. DeJoseph's schedule, and I took 10 days off of work. I had my surgery
10 whole days.
10, well, not even 10. I took 5, 6, 7 days off of work. I had my surgery on Thursday, and then I went back to work the following Monday. And
don't try that at home. Don't do that.
I would never recommend that to anybody.
But
I have to say, I was truly optimized, and I think everything you did for me, fixing my gut, I could eat, so I had enough protein.
Yes.
My weight was up to a normal level. My skin was amazing.
Your skin before you had surgery never looked better. Your skin was
combination of the Sculptra and then having the tribrid laser. You got me on my glow peptides. We did exosomes 2 weeks before.
And your home care routine.
Well, there's that. Yeah. So exosomes inside, exosomes outside, peptides inside, peptides outside. So, and I was eating a great diet because I did the KBMO testing, looking at what caused inflammation. So, I don't think I would have healed well last year when my gut was a mess.
So inflamed, right?
Yeah, I was I would not have healed this way.
I don't think so either.
So everything was optimized. I had my surgery, and then following the surgery, I was super aggressive about healing protocols. So all the vitamins, I had lymphatic massage, I did red light therapy, I did hyperbaric, and it's like the best thing I've ever done.
Well, we were all shocked seeing you at the spa like
a few days
2 days
later.
after, and then 4 days after, and we're like, "What? Where's your swelling? Where's your bruising?"
I didn't have my
pretty
bruising.
dramatic, And I obviously a credit to your surgeon. You had a good experience.
Oh, I had a great surgeon.
But a huge credit to you who did the hard work.
And you.
And me. No, but and you who did the hard work of getting on these protocols, and you were someone who exercised and you're healthy, because it's important too. We can't minimize the effect of exercise, and you really do work on structuring your sleep as best you can, right?
As best I can.
But everyone has a thing. It's not like we are robots, we are perfect at all the things.
Yeah, no.
We know what we need to do. We try to do our best and focus in on what we can control.
Yes,
and you were saying,
exactly.
I'm going to get on these right peptides. I'm going to do my exosomes and IV infusions, my
and
lasers.
did NAD. I did all the.
I know, and your results are just.
I'm so happy.
Like you rock.
It's amazing how this boosts self-confidence.
Oh, I love to hear that.
And you walk by the mirror and you're like, oh, I'm not sitting next to you feeling like an old hag.
Oh, please.
And I mean, I've never really paid attention to like, oh, I'm a lot older than most of the people I work with, or how beautiful our staff is, or any of that.
Beautiful.
They are so beautiful.
Inside and out, though. Those are
inside
really good
and out.
women.
But I walk into the spa and I don't feel like this dinosaur among these vibrant, beautiful young women. And so it makes me feel really happy and really proud of the work that we do together.
Oh, absolutely. Mm-hmm.
And I have so much more, sympathy for my patients and appreciation for what they feel, because as much as I know how to listen and could have, try to understand what they were saying, I never in my life had that feeling of like, no pictures, feeling like you look terrible.
Right.
I've never been like, oh, I'm not going to go out because I look so bad. But I literally have patients who say stuff like that to me. And when you've never had that feeling, it's hard to be truly empathetic.
For sure.
As much as I could sympathize, maybe the empathy wasn't there as much. And so it's been super educational. Like I've been going to conferences for 36 years.
Right.
And just going through this experience, I really learned more than probably...
Completely different. Right.
Completely different.
Tell me and tell the audience a little bit about the buyer's remorse, like what happened.
Oh, yeah.
I think that's
funny.
important. No one talks about that.
No one does. And I've heard this, forever. Like, after you go through surgery, you just don't feel that good. Like, you've had anesthesia, you've, all those things. And then you have an expectation because most people come to me have come from somebody else, and they look at that somebody else and they're like, oh, they look so natural, they look so beautiful, I want to look like that. But they don't understand the process of getting to the healed state.
Right.
And it is a process. So first of all, I hated my little head dressing like all my patients
Everyone
do.
does.
Everybody does.
Right, that's
not
not
it's
comfortable.
terrible.
Right.
So, I was I wanted to rip it off myself, but I tried to be a good patient. And
How long do you keep it on for?
Well, they take it off the next morning, which is what I do.
Okay.
But I wanted to rip it off myself. Like, I know how to take a head dressing off.
I'm taking this off.
But I was good. I went to the office and let them take it off. And then you kind of look at yourself and you go, oh my God, why did I do this? And even though, he just thinks exactly the same way I do, and I knew that I was going to look natural, I was going to look like myself. Those first couple of days where you look in the mirror and you're like, I don't recognize myself.
It's such a stark change.
Yes.
It's a big difference from like one day to the next.
Why do I look like an emoji?
Well, you don't look like an emoji. But
Well, I felt like I did. I'm like, oh my God, I look like an emoji. When is the swelling going to go down? And then really by day 3, I was like, okay, I get it. I'm fine. But as intellectually, as much as I've heard this from patients, when you go through it and you're like, I look like an emoji.
Like a little buyer's remorse, like, oh, I didn't need to do that.
I didn't need to do it. I'm taking a week off work. I can't run for a couple of weeks, all these things.
Right.
But then when you're healed or almost healed or healing, you go, wow, this is really cool.
It's so cool.
It looks
so cool. Beautiful.
I feel really happy.
Oh my goodness.
I kind of forget I've had it done, and then I look in the mirror, I'm like,
oh yeah.
Snatch.
And other people see you, and they're like, someone stopped me. I was like, I saw Diane. She looks fabulous. I was like, I know, doesn't she look amazing?
It's good. I mean, I'm not used to people complimenting how I look, but now I'm like, oh, it's kind of nice.
Of course.
I mean, it's never been in my world before.
But it's something that, you are on the other side of the knife. And that's how your perspective was. I loved what you wrote about that, as being a patient. Oh, yeah. The patient experience, but surgeon as patient. It's just really powerful.
It's a challenge.
We make difficult patients for a reason.
I tried not to be.
But you had a fabulous
I tried
outcome,
to go with the process, and anyways,
And do your own thing, though, too, right?
Yeah.
Like, kind of our healing protocol is unique.
Yes, we are unique.
And that's what makes, I think, our outcomes pretty stellar.
I mean, it's two
and a
things.
notch above, yes.
It's where did you start? What do you need to correct? Who your surgeon is, and anesthesiologist, of course. And then what are you doing to heal? Right. Like the surgeon, I'm a surgeon.
Only do so much.
But can I also now help and be a healer? And that's what's fascinating to me, and especially with working with you and the cellular level and the healing aspect of it. We didn't learn this in medical school.
No,
I was trained as a surgeon. Like, you go to the operating room, you cut, you paste, and you are done.
And me, it's like the ER. You just do CPR or antibiotics or admission / send you home.
Yeah, you ship, you do this or that.
Yeah,
but,
exactly.
I love my practice because I've always wanted to stay engaged with my patients, and the spas have gone a long way towards helping me maintain
those relationships.
And my aesthetic practice, because, people have been coming to me for Botox for 25 years.
That's awesome.
And I see them get married, get divorced, have children, their kids grow up, and I'm like a primary care plastic surgeon. I maintain these really long relationships.
But that's the dream.
And I love doing their second facelift.
Why not? That's what I was going to say too. Tell me about the longevity of a facelift and what
Right.
can patients realistically expect?
Well, again, where do you start? What kind of surgery did you have? And what are you doing to maintain and improve upon the results? And I think one of the things I'm learning is that the results I am getting with different facelifts a lot of times depends on where I start. I mean, this is true about breast surgery or whatever.
Right.
I'm not changing your bone structure. I'm not cutting out muscles.
And skin quality
skin
and all
quality
that.
and all those things. So that's one of the reasons that we have our whole protocol, is that as much as I want to do your second facelift, it'd be really cool if it lasted for longer and you
Yes.
looked better for longer. So what are you doing? So I think, one of the things that I found, and even though I wasn't on a GLP, my weight loss was from something else. And we have many patients who lose weight from gastric bypass or
postpartum, just lose weight.
Yeah, whatever it is. It's important to have a plan. And that's what I think we're really good at, is helping people devise that plan. And again, because we have this med spa that pulls all of these things together, we can really help you over the course of not just the 3 or 4 hours in surgery, but how are we going to not only prolong those results, but also improve on them. So the results that I'm going to be able to give you don't stop when you walk out of my OR or
Right.
get wheeled out of my OR, because I'm interested in that decade-long, what we're doing over that decade
Yes.
to maintain the youth, maintain the health, maintain the beauty, so that you continue to have the self-confidence and feel beautiful and be proud when you look in the mirror. But it's just such an incredible field. I have so much passion for it, as do you.
And the way in which it's growing and changing and evolving,
Yes.
that's what really excites me.
Me too.
The opportunities that we have to
Right.
take better care of patients, to make them cellularly healthy, the tools like Sculptra or what
Right.
have you, right? And GLP-1s, those are really exciting. Let's
Yes.
not forget
Right.
that multimodal approach. Like, are you seeing a practitioner who's really knowledgeable about your
Yes.
inside out health?
Yes.
And as well as outside in.
It's not just a number on a
It
scale.
is not a number on a scale. What's
But
your muscle mass?
I love what we're doing with, like, we give you peptides inside and we
Yep.
put peptides on the outside. I mean,
Yes.
it's so cool, the convergence of these concepts and how it's coming together to really transform lives. This was not what we did in medical school. This is certainly not in
No.
surgery. And
We learned sick care or
Yeah.
cut it out or fix it,
Yeah.
right? But it was just in and out and bye to the patient.
Right.
But this is really partnering alongside people. And I tell people, I'm like, for their 100 healthy years. So at whatever point I'm
Yes.
meeting them,
Yes.
right? And if I'm meeting them in their 30s, great.
Right.
We're 7 decades of let's
Yeah.
do this thing. And if I'm
Right.
meeting people in their 70s who have been doing already amazing
Yes.
work at their cellular health and at their external beauty and health.
And what are the things that you can control? And that's where I think we try to inspire people, is that there's things we can't control.
Of course.
Your genetics, right, you got that. But the environment, the toxins, all those things. But there's so much that we can do to educate our patients to really live healthier, happier, more productive lives.
And really well-informed lives,
well-informed,
right?
yes.
Like how we've talked about, it's database, it's science-driven, it's not
right.
just, I feel this.
It's
this.
not Insta.
And you've also done it.
Right.
Tried and true. Many of the
Yes.
things I've done and tried too. So
Yeah.
I think really that the call to action
Yes.
is, what difficult conversations have you been avoiding?
Right.
Are you feeling unwell or unhappy with the way you look and kind of just resigned to, oh, well, I guess this is it? Like, this is
No.
not it.
Yeah.
Please do not do that. Don't take that posture. It's
No.
going to affect your relationships with your family and your marriage and your colleagues at work. You want to show up as your best self.
And your productivity.
Yes,
I mean,
and feeling
just-
and looking your best.
Yes.
Right? And that, like, love of self is so important. And I think we can love ourselves at any health stage and aesthetic stage or what have you, but there is something about having that external confidence and that internal motor, like the optimal engine.
I do love that people are starting younger.
Okay.
Like in their 30s. Yeah. You know, because
you're saying injectables, lasers, for sure.
And you know, because it wasn't even a consideration in my 30s. Somewhere in my 40s, even though I was in plastic surgery, I was like, oh, my skin looks bad. I was like, I need to do something about this, and I did.
For medical grade skincare, like having that really accessible. Do not leave that on the table. Like patients can't just say, oh yeah, the drugstore, whatever I'm putting on my face, and then spending thousands of dollars on injections or a laser.
It's shocking to me. Yeah. And like, what products do you use? I don't know. I pick it up at CVS. I'm like,
no.
Yeah, it doesn't.
Start there.
Yeah. So it's what you're doing on it. And I'm testament to it because, I started good skincare routines in my 40s. And my skin is so much better than it was back then.
But isn't that incredible that
it's
you
incredible.
Can confidently say that in your 60s?
I can confidently say it, yeah.
And I'm looking at you
I'm in
from
my 50s
a few
now.
feet away. Oh yeah, she is. She reverse aged. Now that we've got
I'm only 55.
so many more years of surgery and of helping people together. So that was awesome.
We got it.
Thank you.
65 going on 55.
Thank you so much again for listening to us and joining us in the Art of Wellbeing. Please comment, like, subscribe, and if there's anything you want to hear us talk about, leave it in the comments. Bye.
Bye.